All right, if you're in the hospice industry, you really need to listen up because a major overhaul is coming down the pipeline. Today, we're going to break down a huge proposed rule from CMS that's set to impact pretty much everything, from your payments all the way to your compliance strategy.
And wow, this quote from the top of CMS, it really sets the tone, doesn't it? This is an incredibly strong signal that they're planning a major crackdown on fraud, waste, and abuse in the hospice world. Program integrity is clearly their #1 priority.
So what's their answer? Well, it's this new proposed rule. And you have to understand, this isn't just one small tweak. No, this is a whole collection of pretty significant updates to payments, to transparency, and to oversight that are going to affect every single hospice provider out there.
So here's how we're going to break it all down for you. First, we'll follow the money and look at the proposed payments. Then we'll dig into a brand new scoring system. After that, we'll review some new integrity rules. And finally, we'll see how this is all playing out at the state level with a look at what's happening in Texas.
Okay, let's get right to it. First up, the part that probably matters most to your day-to-day, your bottom line. We're talking about the proposed payment updates for fiscal year 2027.
CMS is using a classic carrot and stick approach here. And this right here, this is the carrot. If your hospice meets all the quality reporting requirements, they're proposing a 2.4% payment increase. That's a big deal. It translates to an estimated $785 million boost to the sector nationwide. And here's the stick. If you fail to submit that required quality data, you don't just miss out on the raise. You face a 4 percentage point reduction, which actually results in a 1.6% cut from the previous year's rate. The message from CMS could not be clearer. Reporting is not optional anymore.
The updates don't stop there, though. The annual payment cap per beneficiary is also getting an adjustment. The proposed statutory cap for fiscal year 2027 is now set at just over $36,000.
So, the payment changes are one thing, but that's really just the beginning of the story. Now we get to see how CMS is planning to use data and transparency to really drive accountability.
The star of the show here is this new thing called the Service and Spending Variation Index, or SSVI for short. The best way to think of it is like a comprehensive report card for your hospice, and it's all calculated from claims data specifically designed to flag any hospices that look like statistical outliers compared to their peers.
Now, you might be looking at this list and wondering, why these specific things? Well, CMS is zeroing in on metrics like non-hospice spending, really long stays, and live discharges. And the reason is, these can all be indicators of deeper issues. You know, things like enrolling patients who aren't truly eligible or billing for services that aren't actually being fully provided.
So, that of course leads to the million-dollar question for every single provider out there. What happens if your facility gets a high SSVI score?
Now, CMS is quick to say that a high score doesn't automatically mean you're committing fraud. But let's be real. It is a huge red flag. It tells the agency that your facility needs a much closer look, and it will almost certainly trigger more scrutiny to check for any compliance or program integrity problems.
And to really hammer this point home, CMS is getting, well, very public about it. To deal with these persistent gaps in data, they're proposing to add a brand new icon to the Care Compare website. And this icon will identify the roughly 1 in 5 hospices that consistently fail to report their quality data, basically making it crystal clear to consumers who's being transparent and who isn't.
Okay, so we've talked about data, we've talked about scores, but this new rule goes even deeper than that. It's also about changing day-to-day operations to strengthen integrity.
This right here, this is a huge shift in how you have to communicate with patients. Right now, that addendum that explains what's not covered by hospice care, you only have to provide it upon request. Under the new proposed rule, it would be mandatory for every single beneficiary at the time of election, no exceptions. And the whole point of this is pretty simple, right? It's all about empowering patients and their families. By making this information a standard part of the process, CMS is hoping to wipe out confusion, prevent those surprise out-of-pocket costs, and just make sure everyone has a clear understanding of coverage at a really vulnerable time.
Now, you might think this is all just a big federal thing, but these ideas aren't just happening in a Washington, D.C. bubble. To see how these concerns are playing out on the ground, let's take a look at what's happening at the state level, using Texas as a great case study.
So, in a recent legislative hearing, hospice advocates in Texas were pushing the state to use its own data to spot red flags. And take a look at what they're asking for. Tracking ownership, irregular billing, beneficiary sharing.
Does any of this sound familiar? It should. These are the exact same kinds of issues that CMS is targeting on the national level with that new SSVI. It's proof of a coordinated focus on these problem areas.
So what's the big picture here? The key takeaway is that this isn't just a federal trend. This is a full court press. Whether you're dealing with CMS or your state health commission, the demand for transparent, data-backed compliance is getting a lot louder. The pressure for accountability is absolutely coming from all directions.
And that leaves us with one final and pretty important question. This rule really signals a fundamental shift in the industry. In this new landscape, where data is going to drive everything from your payments to your audits, just doing the bare minimum to comply isn't going to cut it anymore. Surviving and actually thriving is going to mean embracing this transparency and proactively using your own data to prove you're providing the highest quality care possible.